Webinar, OSHA update presented by our sponsor, Heffernan. We're super happy you can join us today. My name is Michelle Wilcox and I will be your moderator, and I will also be monitoring questions you may have during the session. Before we open up the session, let's review a couple of key items. All of the webinar materials we discussed can be found at the URL currently showing on your screen. I will be sharing this URL in a follow-up email, so don't feel like you need to write it down right now. If you have trouble with your internet connection during the webinar, we recommend leaving the presentation and logging back in. We do not control the audio, your devices control the audio. So if you have audio difficulties, try adjusting the volume settings on your device. If a telephone line goes dead during the call, hang up and call back again at the same number. If all lines go dead, watch the on-screen question box for an alternative call-in number. Feel free to ask questions or provide feedback by using the questions box during the webinar. If you are using a tablet, you may need to tap on the screen for the options bar to appear, and then you can select the appropriate option. We may not respond immediately, but we will work your questions or feedback into the presentation. If we can't get to your comment or question during the session, we will be online afterwards to respond, or we may follow up in an email if we run completely out of time. You may also email us at moderator@aspenrmg.com for up to 48 hours after the webinar. This will be a 1-hour presentation. Questions and comments are very much encouraged throughout, and the presenter will be answering questions at the end. And lastly, we have a number of upcoming webinars covering a variety of topics, including those listed at the Heffernan webinar website. With that, let's begin today's webinar. Our presenter today is Pam White. Pam has been a workers' compensation, risk management, and environmental health safety, and having worked as a loss control consultant, senior VP of risk management, and regional manager for more than 20 years. Most recently, she was a senior vice president running a large loss control team. She holds designations such as ARM, SIP, and CPWC, indicating expertise in risk management and insurance. She also has experience working with captive programs and self-insured, high deductible, and retro plans. Pamela's work history and education demonstrate her ability to assess client needs, develop tailored safety and risk prevention programs, and implement effective risk mitigation strategies. She has experience in conducting root cause analysis, loss prevention reviews, and training sessions on workplace safety. And with that, I'm going to go ahead and hand this over to you, Pam. Thank you for being here today.
Thank you, Michelle. I really appreciate that. Good morning, everyone, and welcome to the OSHA Update webinar. I'm excited to be here to talk with you about OSHA this morning. Before we get into things, I wanted to point out really quickly this disclaimer. This information is going to be presented in general. It has not been applied to specific information from your company, and therefore is only an overview, not consultation or advice. This presentation does not establish a client relationship between the presenter and the attendees. Okay, so our agenda this morning, we are going to take a look at the national fatality and injury statistics from the Bureau of Labor Statistics. We're going to take a look at what OSHA is working on, new items that have been put into place, top 10 citations, and some next steps for you. Then if we have some time, we will address your questions. If not, please feel free to email them, and we will respond to everybody's questions after the webinar. All right, so before we begin reviewing this data, I want to explain where it came from and make it clear that the data available is from the Bureau of Labor Statistics, and this is from 2024. There's a delay in the data for fatality and non-fatal workplace incidents to allow time for accurate data collection and statistical review. Next year, we'll be able to discuss the 2025 loss data. But taking a look at at this chart here, the total fatalities were 5,070 recorded fatal injuries, and that's down from 5,283 in 2023. So the fatality rates had dropped. We're at 3.3 deaths per 100,000 full-time workers, which is down from 3.5. So that's progress, and that's always a good sign when we can see those rates dropping. In this slide, you'll also see that the comparison the BLS did was to California. So the blue is federal, and the green, obviously, here is California. So let's start things off with our first poll question. What do you think is the leading cause of fatalities in the workplace?
Is it going to be falls, slips, trips, transportation incidents, violence in the workplace, or contact with objects? And again, we want to thank everybody for being here today. And we appreciate your participation in the polls. All right, so I'm going to go ahead and close the poll, and it looks like majority says 50% false trips, 31% say transportation, 11 say violence in the workplace, and 7 say contact with other objects.
Okay, and the answer is transportation incidents. So driving is an exposure for nearly every single business. So it's important to recognize that as much as OSHA focuses on preventing falls from heights, driving or transportation results in the most fatalities across these industries. Transportation incidents were 1,937 cases, which is 38.2%. They were the top cause, followed by falls, slips, and trips. So this is falls from heights and other types of trips and slips. So that accounted for 844 cases, and violence injuries by person or animal resulted in 733 cases. So the highest risk that transportation happens in is the agricultural, forestry, fishing, and hunting. It's been the highest fatality rate at 20.9 deaths per 100,000 full-time employees. So despite the lower absolute numbers in construction, this is still the #1 cause of fatalities. All right, let's switch gears here a little bit and look at how that actually broke out in this table we just saw. So we talked about that there was 1,937 cases. For falls, slips, and trips, there were 844 cases, which is a decrease of 4.6%, which is great. Violent acts was 733 cases, and that include 470 homicides. So the industry and occupational data states that 1,391 fatalities are the highest among all occupations for the transportation. So construction and extraction resulted in 1,032 fatalities. And then we have exposure to harmful substances, which dropped by 16.2%, was driven by a 20% reduction in drug and alcohol overdoses. So that dropped to 410. Now, why this has been a big change, there's no real clear indicator, but in California, they did start whole campaign around making sure that they provided in to employees emergency rescue equipment, chemicals for drug overdose. So that may have played a part in the rate. So let's look at this fatality injury rate for Hispanic or Latino workers. That dropped to 4.3 per 100,000 full-time employees, while the number of deaths for African Americans workers decreased to 624. In the construction and extraction workers, their primary drivers were fatal falls, slips, and trips. Among these workers, it decreased 7.5% to 370 from the 400 in 2023. Worker fatalities among building and grounds clearing and maintenance workers increased from 356 from 337 in 2023. Fatalities among protected occupations slightly increased to 281 in 2024 from 276 in 2023. Homicides, 97 of them accounted for 34.5% of these fatalities in 2024. Much too high. I think you'll all agree. Let's step away from the workplace fatalities now and talk about non-fatal injuries and where these occurred in 2024. This chart provides a comparison of total recordable injury cases and shows in orange the cases involving days away from work, job restrictions, transfer, and other recordable cases are in green. You can see that the number of recordable cases here has fared just slightly better than in 2023. They stay fairly consistent. There's been a slight decrease in the number of days away from work or with restrictions in 2024. The incident rates that you're seeing here are labeled based on 100 full-time employees. So they use this method to compare small and large companies by figuring out the rates based on the same number of annual hours worked. You'll see this used throughout all of the BLS charts. So let's look at this a little bit more closely, and let me give you a little bit of information on the non-fatal injuries. So private industry saw a 2.49 million recordable non-fatal injuries and illnesses in 2024, which is a 3.1% decrease from 2023. The top causes of non-fatal injuries involving days away from work was contact incidents at 27%. So cases involving falls, slips, and trips numbered 479,048. There were a total of 2,488 in 2024. So as you can see, everything's pretty much stayed consistent from 23 to 24 with only slight decreases. We have another poll question for you here. Michelle?
Okay, which regulations do you think was cited the most in 2024? Machine guarding, lockout, tag out, ladders, or fall protection? I'm going to give it a couple seconds here.
Okay, that's actually 2025. So last year, OSHA came out with their new numbers, so I grabbed them.
Gotcha. Okay, we'll give it a couple minutes again. Thank you guys for everybody for participating. We appreciate it. And I'm going to go ahead and close the poll. And we've got majority says lockout, tag out. Second is ladders. Third is machine guarding. And 42 is fall protection.
And the answer is fall protection. So for the last 15 years, fall protection has been the number one cited OSHA regulation. So these top 10 citations are based on fiscal year, not calendar year. So fiscal year runs from October 1st to October 30th of each year. It's good to know what these are and what's required, because you want to make sure that you've addressed all of them in your workplace. This is OSHA telling you what they're catching most companies doing wrong. Lockout fell below respiratory protection from last year, which is the only change to the top 10 this year. The citations most frequently cited in 2025, as we talked about, was fall protection. It doesn't usually change very much from year to year, as you can see. The top 10 are fall protection, hazard communications, ladder, respiratory protection, lockout, tag out, powered industrial trucks, and then machine guarding is the last thing. A lot of times the machine guarding and lockout, tag out are kind of hand in hand, because they're always looking at your machine guarding if there's an injury or an incident that's aligned with a lockout, tag out failure. So with fall protection, it's scaffolding, personal protective and life-saving equipment, and machine guardings. The last one here on the list. So when you're looking at your fall protection, make sure that if you're putting people in fall protection equipment, that you have a rescue plan. I'm seeing this cited all over the place. So there's a lot of different methods that you can utilize to make sure that you have a fall protection plan. If you're working at heights and you have to get a permit, that permit is going to include a complete fall protection plan. So not only do you have to post it, you also have to have the machinery and equipment that you're going to use for an emergency rescue on site and manned at the time. So what we saw with fall protection is that they were monitoring the fatalities from falls from heights. When they're citing for these fatality investigations, they're citing for fall protection training, ladders, and scaffolding. So they're all related to companies not using the proper methods to prevent these types of injuries and fatalities. Making sure that your people know how to calculate the fall distance and are using the right equipment and they're donning and doffing it correctly is huge. I think everyone should have a update training to make sure that they're understanding the requirements for tie off, the necessity for the lanyards to be the right length, with scaffolding that they're inspected prior to use each day. If they're not inspected prior to each use and another contractor removes some of the toe boards or planking, even if the scaffolding was erected by a third party, your company will be the one that gets cited. So keep that in mind. Also here you see that safety around chemicals pops up a lot in these citations, with hazard communications in the second spot. Respiratory protections at number 4 and PPE at number 9. And we're going to talk about some initiatives that are going to be moving forward this year on PPE and chemical exposures. All right, so this slide here is showing you the Occupational Health Administration's saturation. And if you take a look at it, the states in dark blue only cover state and local government employees. while the medium blue states cover state and local government, workplaces, and private industry. Light blue states and light blue states all fall under the federal OSHA regulations. So make sure that you know what regulations that you fall under. I think a bit of a misunderstanding is that if you're in a state plan such as California, do you have to follow the federal regulations? And it depends on where you're at. Military bases fall under federal regulations. Many times they are following EM 385 1-1 regulations. So it does depend on where you're at and what type of work that you're doing. So the state and federal plans are usually divide their operations into enforcement and consultation, although they also have specialty units for elevators and pressure vessel units. These voluntary compliance programs are really a fantastic way for your company to be involved with OSHA and not have to worry about receiving citations. And they do a variety of things. In my career, I've worked with voluntary compliance. I worked with them for 6 years, and I got the first company in the state in the SHARPS program, which is the highest level of regulatory compliance in the state. And they looked at every single written program that we had. They assisted us with some industrial hygiene, things that were at no cost to us, provided training for staff members. And so it was a really, really good experience. And I think that if you've been considering working with voluntary compliance, that you should give them a call and have a conversation, because there's a lot of things that they're willing to do to help your business without worry of getting any types of citations. The only situation that you would have to be aware of is if you're working with voluntary compliance and there is a situation that is an imminent hazard, they would have to make sure that you corrected that immediately while they're on site. Okay, so moving on. So federal OSHA finalized their PPE standard. That was in the presentation last year that they were working on it. And so what they've done is they've created this rule that covers all the necessary protective gear, including head protection, eye, face protection, respiratory equipment, and protective clothing. So the revisions clarifying existing regulations, emphasizing that PPE must be of safe design and appropriate for the individual worker. This took effect January 13th of 2025, and a lot of companies are still working on making sure that they're in compliance. They also have proposed updating its power industrial truck standard. Talked about that last year. So the provision is related to the design and construction of powered industrial trucks that was published by ANSI. Employers should make sure that their equipment complies with the most applicable ANSI standards for their equipment. The powered industrial trucks design standard update has not been finalized as of yet. So let's look at some more proposed regulations so you understand. Proposed regulations are ones that still allow for feedback from stakeholders and are having public hearings. OSHA will review and analyze all the written comments, exhibits, and testimony and create a, a record summary and analyze before the final health effects analysis, risk assessments, and technology. So the text will be drafted and then it must be reviewed and approved by other government entities, and then they have to create rollout material. So it's not a quick process. So this is a list, and it's a long list of federal OSHA's agenda for their that are of the topics that are in their proposed rule stages. We'll touch on a few that are highlighted after the next poll question, and those things related to crystalline silica. So silicosis is an incurable and sometimes deadly lung disease that's caused by exposure to silica. So they're still working on the communication tower and tree care rulemaking. Both of these activities are high hazard, so OSHA's been working on improving safety for the employees. They've developed special pages that have hazards and solutions, and these are all these pages can be found at www.osha.gov. So take a look at them. There's a lot of useful information. As you can see, they have links to the FACE program and information on palm tree workers. There's been a death in California, so any information that is in conjunction with things that they're working on, you can find more information there. The fatality rate for the workers in communication tower industry is higher than the construction industry. So OSHA believes that the current OSHA requirements such as fall protection and personnel hoisting may not be adequate for those workers in the communication towers. So you're going to see some changes in that area as well. Okay, so in 2026, OSHA and some related agencies are strengthening workplace safety through formal regulations targeting high-risk violence areas, tightening silica enforcement, and expanding training to include mental health shifts from voluntary compliance guidance and into mandatory compliance programs. So workplace violence prevention, that's where you're going to see a lot of the voluntary guidance that is made into mandatory programs. So for high risk scenarios, the regulations are specifically targeting industries including healthcare, social services, and lone worker scenarios. So the lone worker scenarios are looking at security, delivery, and remote personnel. So as an employer, you must develop formal written plans, conduct hazard assessments, implement incident investigation procedures, and often training, including reporting avenues that allow for anonymous or third-party reporting of threats. So the regulations will emphasize preventing the type 3 violence, employee on employee, and addressing hostile work environments as a potential hazard. On the silica exposure, they are increasing their scrutiny. They want stronger proactive enforcement on crystalline silica, particularly with the new OSHA and OSHA standards to protect against fatal silicosis. They're increasing the strictness of the PEL, so they're going to continue to the enforcement of the permissible exposure limit of 50 micrograms per cubic meter. on an 8-hour time weighted average. So for the controls and monitoring, they're mandating stricter engineering controls such as water spraying, wet cutting, ventilation, and medical surveillance for any of these workers that are exposed to high level. Training requirements are expanding beyond the basic safety to include mental health, workplace stress reduction, and advanced machinery safety. So you'll see some changes coming in that. So make sure that you look at the regulation and look at the training section as those things roll out. So they've recognized the link between burnout, stress, violence, and the training is increasingly expected to cover, identify, and reduce psychological risks. This is a bit of a change because it's always been about the physical hazards that are in a workplace. So make sure that you stay on top of looking at what actually does get through the proposed stages and keep your safety programs up to date. Okay. So we talked about the silicosis, and there is a silicosis crisis in California as we speak. Washington is also experiencing this issue. So they came out with Senate Bill 5092, where the Washington Labor and Industries, or the LNI, is initiating rulemaking for occupational health protections to make sure that infectious disease is following the general guidelines and making sure that there is not any infectious disease outbreaks. So the conclusions of the fatality investigations relating to the trenching and excavation in recent years suggested a better approach to risk analysis and rescue planning could serve to greatly reduce the likelihood of similar fatalities in the future. So according to LNI, it's considering requiring employers to develop and implement a written excavation plan detailing appropriate risk analysis and rescue planning prior to beginning any work that requires a protective system. So generally defined as any excavation of 4 feet or deeper that is not stable in solid rock. So if you're in Washington, make sure that you take a look at that. Let's talk a little bit about the silicosis crisis that I mentioned in California. So California's Department of Industrial Relations, Cal OSHA, has implemented strict emergency regulations to protect workers from fatal silicosis caused by cutting engineered stone countertops. So that's things such as quartz, which contain up to 95% silica. Rules are mandating wet cutting, prohibiting dry cutting, enforcing strict respiratory use, and this is due to over 500 confirmed cases of silicosis in California. So they are considering a ban on high silica artificial stone. So Cal OSHA enforcement has the authority to stop work and close shops violating these safety standards. So they're not playing around at all with this. So as an employer in California, your obligations are to provide training, safety equipment, maintain a compliant wet process workshop, and to reduce worker exposure below the established exposure limits over a 8-hour time weighted average. So there's quite a bit of concern about this silicosis issue here in California. All right, let's have another poll question here, Michelle.
Here we go. So do you have a plan for how to handle OSHA if an inspector shows up at your company? Yes or no? And I'll launch the poll. Give it a minute here. I live in Washington, so that silica information is, I'm gonna have to Google it. Okay, we've got, let me, I'm gonna go ahead and close it once we get to 60%, which we are there. Thank you again for participating. So it looks like 67, or I'm sorry, 61% say yes and 39% say no.
Okay. Well, we want to get that to 100%. Yeah. All right. So let's talk a minute real quick about some updating standards. As you know, the hazard communication and chemical standard has been under revision. Last year, some things went into effect, and they're continuing to update due to changes in technology, performance specifications, and major developments in safety and health practices that a lot of these industries have already incorporated. So under the umbrella of OSHA's new standard for 2026 for worker safety, you'll see there's a link here for updates to the hazard communication standard so you can follow and get into alignment with them. And what they're doing is they're updating to make sure that they're in sync with the globally harmonized system. That's already active. Their final rule to amend the HCS was published in 2024, and I think you all remember that, aligning with the GHS standard. And so now we're looking at the GHS revision 7. And you'll see this across all the states. They're all working on this and making sure that they stay in compliance. In California, they adopted the GHS standards that the federal government had via HORCHR, so it is exactly the same. And so when you see those types of adoptions come through, they're always going to do revisions in sync with federal OSHA. So future phases are expected throughout 2026 as part of the occupational health compliance timeline. So review your hazardous chemical labels, your safety data sheets, and your training to make sure that they're meeting the updated criteria, and you should be in good shape. One of the most anticipated components of the OSHA's new standards for 2026 is worker safety. So it's the Federal Heat Illness Prevention Rule. OSHA's webpage confirmed that they're continuing to work on the rulemaking for heat injury and illness prevention in outdoor and indoor work settings. So you should anticipate that these requirements, such as access to shade, rest, and hydration for all your workers that are exposed to heat, acclimatization programs for new and returning workers. So any new worker should be considered to need to go through your acclimatization process. Any worker who's been off for several weeks and then returns to work should be closely monitored. You need to make sure that your training's up to snuff, so monitoring for the heat stress signs and the response protocols are well understood by everyone. Early commentaries indicating that these standards will apply across general industry, construction, maritime, and the agricultural sectors. Okay, so we have a poll question here. What industry
I'm sorry.
Oh, okay.
Go ahead.
What industry has a rate of workplace violence that's nearly 5 times the rate experienced by all workers? A, construction, B, healthcare, C, retail, or D, education?
I went ahead and launched it. We look like we had an extra polling question in there that that's why it's like a little, what's going on? Okay, I'm gonna wait for a couple seconds here. I like to wait until it's 60%. And I'll go ahead and close it. So 52% say healthcare, 20% say construction, 20% say retail, and 9% say education.
And they would be right. Healthcare is the correct answer. So let's take a look at the workplace violence in healthcare. So approximately 20 people die each year in the healthcare industry. It has the highest rate of non-fatal workplace violence injuries. It accounts for 45 to 50% of all non-fatal workplace violence cases. Workers are 5 times more likely to be assaulted than the average worker. So if you're in the healthcare industry, this is something that, really, really takes some focus. Everyone should be put through training for diffusing workplace violence, emergency response procedures, all those types of things need to be trained on. You need to have a solid workplace violence program. As we know, you're required to have a workplace violence program specific to healthcare. So anything that can be done to make sure that everyone who is exposed to this knows how to deal with it and has a good grip on what procedures that they should follow if they find themselves in an escalatingly volatile situation. All right, let's look at some information here on this lockout, tagout, and machine safety for 2026. So enforcement intensity here, lockout, as we saw, continues to be a top 10 violation with citations increasing in 24 and 25. Enforcement in 2026 is heavily focused on the lack of written machine-specific procedures rather than just a general policy. So if you do not have equipment-specific lockout, tagout procedures, now is the time to get working on that. So one of the easiest ways to make sure that you're getting your equipment-specific lockout procedures developed is to make sure that you have the owner's manual and follow what the manufacturer's guidance is. A lot of pieces of equipment will have both the operator's manual and a maintenance manual. So if you haven't done so already, now is the time to make sure that you get your equipment specific lockout, tagout procedures going. So also, they're looking at when they're on site, do the employees demonstrate that they understand these methods? Are they effective as physical locks, especially during testing or repositioning? So don't be surprised if you get an enforcement visit and they want your maintenance folks to demonstrate their lockout procedures. 2026 priorities include ensuring all staff working around this machinery received updated lockout tagout training and that hazardous energy control procedures are validated. So you may have seen where lock it out, tag it out, try it out has been kind of emerging on the scene. And so that's really the validating that the energy has been dissipated. All right, so let's talk about emergency response standards. They were proposed to run through 24, changes were proposed from 2024 through 2026. It's a modernization. OSHA is in the process of replacing the 1980s fire brigade standard with a new emergency response standard, 29 CFR 1910.156. The proposed rule expands coverage to include hazardous material, technical search and rescue, and emergency medical services affecting both public and private sectors. So the key proposed changes are requirements to include stricter training programs, baseline medical screening for responders, and updated protective equipments. On the cranes and derelicts, the focus area is going to be to continue to focus on preventing electrocution, crushing, and collapse by emphasizing qualified evaluator requirements for operators. OSHA is finalizing the updates regarding the scope of equipment, specifically multi-purpose machines, which are covered, as well as addressing the unavailability of certain proximity alarms. So there is a proposed exemption for railroads. So in 2026, they're going to provide specific exemptions for railroad machinery, flash butt welding trucks, and when used on track work, but not for bridge construction. So shipyard fall protections, there are some changes here and some heightened requirements. So fall protections required in shipyards at 5 feet, not 6, but 5 feet. Another change is in the lone worker rule under 29 CFR 1915.84. If an employee is working alone in a confined space or isolated location, the employer must account for them at regular intervals. So if you don't have a plan in place for that, now's the time to take a quick look at that. So there's also part of the long-term transition is in fixed ladders. The final compliance piece is not expected till 2036 to replace the cage systems with personal fall arrest systems on fixed ladders that are over 24 feet. With crystalline silica, you're going to see aggressive enforcement from OSHA. They're prioritizing enforcement of the respirable crystalline silica standard, which is 1926.1153 in construction and manufacturing. So you'll see inspectors focusing heavily on employers' written exposure control plans and the proper implementation of engineering controls, such as water delivery systems. So 2026 brings less tolerance for gaps in safety records. Employers must be prepared to produce training records, 300 logs, and written programs quickly during inspections. Okay, we have a few proposed rule regulations here. With Washington, they're working on cranes, rigging, personnel lifts, fire-resistant material applicators, standards, improving the tracking of workplace injuries and illnesses and workplace violence in healthcare, which we already talked a bit about. For these things, the whole thing around the cranes and rigging we've talked a little bit about, and they're still working on these. They are open for public communications about them. So if you want more information on that, the presentation we'll send out will have a direct link to the rulemaking activity for you to look into those a bit further. Okay, we have another poll question here.
So just to make sure we're on the same page, is that workers may be exposed to silica and sand, stone, concrete, brick, and mortar when they select all that apply? So the options
No,
are,
this is the leading cause of death in women in workplace.
okay.
Okay, I'll take it from here. What's the second leading cause of death for women in the workplace? Is it transportation, slip, trips, and falls, homicide, or fire and explosion?
So I've gone ahead and launched it. So give it a couple minutes here. And I'm going to go ahead and close it. So 40% say slip, trip, fall, 40% say homicide, 15% say transportation, and 6% say fire and explosion.
Okay, and the answer is homicide. The second leading cause of death for women in the workplace is homicide. This statistic holds true year after year. Some others have changed. Roadway incidents used to affect more men, but that's starting to equalize, as you can see here on the chart. When you look at homicides in the workplace and how women are affected as opposed to men, it's pretty shocking, I think. I encourage you to have a system in place that enables employees to notify you if they have a restraining order or otherwise feel unsafe, and to have procedures preventing access to your workplace to anyone who doesn't work there. Check in with employees before you allow a spouse of this or a significant other to visit them in the workplace. So this is still continues to be an issue that needs to be addressed. Women accounted for 8.1% or 413 of overall worker fatalities, but 15.3% or 72 of the fatalities were due to homicide. So make sure when you're drafting your programs that you are addressing this issue and you put these protocols in place. So let's look at what's new for 2026. California's got some regulations that are moving right along here. As you know, it's ongoing for the heat illness prevention. They're intensifying enforcement. Anytime a OSHA inspector comes on site, they now have a directive that not only will they ask for the injury and illness prevention program, they will also ask for your heat illness prevention program. So if you have not updated that, it's a really good time to do that. The implementation of the comprehensive workplace violence prevention standard is due in 2026 for the general industry. As you know, we already have workplace violence prevention program requirements in other industry in healthcare, and so they're solidifying to make sure that general industry workplace violence is done and ready to go. The worker walk around rule, this is proposed. It's a proposed regulation. It looks like this is going to go through, and it would allow third parties like union reps to join inspectors in walk-arounds if they deem it necessary. Emergency contact rights went into effect March 30th of 2026. Employers must allow employees to name a personal emergency contact. And just as a reminder, California now has a no-touch law. It prohibits drivers from holding or touching a smartphone for any reason. They can't text, browse, navigate, use GPS while they're driving or at a stoplight. The device has to be mounted, and it allows only a single tap or swipe for activation. So this is going to be something that if you have not updated your fleet safety program, you should do so. Make sure that you do training with all of your drivers on this. I understand that the first time there's a citation, it will be around $1,000, but you know, California, they have all the additional things that they add on that you have to pay whenever you get a citation like this. So it's likely to be much more than that. Secondary violations will be $10,000 or more. And if you get a second violation within 36 months of a prior conviction, it adds points to your driver's license. The only exception to this is going to be the emergency personnel. They are exempt. Passengers are still free to use their phones freely. So for your own safety, your fleet safety, and to avoid penalties, you should make sure that your drivers are configuring their navigation, music, or phone calls before they ever start their vehicle. Okay. So change in confined space in construction, there now has to be a competent person that conducts the initial survey, identifies permit required spaces, and communicates new hazards at the time work begins. So if you don't have a competent person on every job where you have a confined space, you'll have to rectify that. That's going to be something that everybody is going to need to take a look at. Lead exposure limits that went into effect on January 1st of 2026. The permissible exposure limit was drastically cut from 50 to 20 micrograms per deciliter. That's going to make a big difference in your program. So if you are dealing with lead exposure, make sure that you update your program to reflect this change, and that you make the additional changes that you'll need for providing changing rooms, end of shift showers, lunchroom facilities, and the way that you manage and handle employees who have airborne lead exposure that's above the permissible exposure limit. Personnel records effective January 1st of 2026. There were specific education training record requirements that need to be available for inspection, including the trainee's name, date, duration, certification results. Okay, this is a continuing push that California has to lead the nation in stricter workplace safety standards and expanded employee rights. This is just a reminder for everyone in California, if you were not already aware, that last year AB 2499 went into effect. So this is just an example of the posting or the documentation that should be provided. You can use any form of this. This is a flyer that was made available by California Civil Liberties. It's on their website. It's available in both English and Spanish. But this is something that you must add to your new hire orientation, because this has to be provided at hire annually upon request, or when an employee discloses their victim status of their self or a family member. This is a mandatory notice. It's similar to other California employment posters, but it's more targeted and event triggered. It works with your workplace violence manual. It's complementary, not duplicative. They work together, but they're different compliance pieces. they operate in tandem but serve different functions. So the workplace violence prevention is for the employer safety system, and this CRD notice is an employee's legal right and protection. There are,
Sorry to interrupt you, Pam, but we're at 11 o'clock and I know people have places to go. We haven't even got through the presentation, so I want to apologize to everybody. We have a handful of questions. Is there anything you want to say to close up the presentation?
no, I think that we've covered already all of the changes that are on the federal and state horizon here. We've hit some pretty important things, and I'm happy to answer questions.
Great. And I will be sending those, and I've let everybody know that has asked a question that I'll be responding to them via email individually. But I want to thank everybody for attending today's webinar presented by Heffernan. We'll send the information by email with instructions on how to access a copy of the presentation on our website. Thank you, Pam, for your time and expertise today. We hope all the attendees found today's webinar to be a valuable use of your time. Be sure to join us on May 19th for our active shooter armed assailant response training for the DHS Run, Hide, Flight Protocol webinar. Thank you all and have a great day.